Hi, welcome to my presentation. My name is Betsy Reynoso. This is my class, Role of the ATA, OTA 1120. Let's begin. We're going to explore the traditional setting for OT practice. The one that I chose was acute inpatient rehabilitation. In this kind of setting, the OTA usually works in a hospital. The main goal is to help patients regain or develop skills needed for the activities of daily living. It focuses on high volume of therapy sessions each day, where they practice transfer training, upper or lower extremity exercises, and adapted equipment training. This can be anywhere between 3 to 5 treatments a day, depending on the facility. The goal is to rapidly improve function and independence. It's a patient-centered approach, and it works in collaboration with other disciplines such as doctors, nurses, and physical therapists. The population type that you deal with in acute inpatient rehab is wide. It could be anywhere from children, teenagers, young adults, adults, or seniors. Individuals that are treated usually have gone under uh, significant medical events such as major surgeries, strokes, severe trauma, and/or heart attacks. Patients' conditions are usually acute and have complex conditions. Most common diagnoses seen in acute rehab are neurological disorders such as traumatic brain injury or spinal cord injury, or orthopedic conditions such as hip replacement, fractures, or amputations. Supervision of the OTA at acute inpatient rehab. In California, the OTAs that work in acute inpatient rehab generally operate under general supervision. This means that the supervising OT does not need to be present during treatment, but must be available for consultation and communications. The OT must provide initial consultation, evaluation, treatment plan, and periodic reevaluation of the client's progress. The OT must ensure the OTA implements a plan accordingly. In acute inpatient rehab, the OT must have direct contact with the client at least once every 30 days to reassess the client's progress and modify the plan of care as needed. In California, OTAs must be supervised at least once every 30 days, and the supervising OT must review and co-sign all notes written by the OTA. The OT must document all supervisory activities, including the frequency, methods, and contents of supervision. The OTA must also document their interventions and communicate any changes in the client's conditions to the supervising OT. For experienced OTAs, routine supervision may involve periodic check-ins and case reviews in contrast to newer OTAs or complex cases. Closer supervision may be required, including more frequent communication and direct observation of the OTA's performance. Now let's move on to a non-traditional setting for occupational therapist practice. I chose home health care. In this kind of setting, the OTA works with the patients in their own homes. Main goal is to help patients regain or develop skills needed for activities of daily living. They focus on their real life environment. They individualize the treatment plan, work with adapted equipment training, and home modifications. Population types that receive OT at home health care can also be broad. It could include children, teenagers, young adults, adults, and seniors. Usually, you're looking at individuals recovering for surgeries or stroke, and individuals with cognitive impairment affecting daily functions, or children with developmental delays. Patient conditions usually are stable and/or are dealing with chronic conditions. Most common diagnoses for patients in our home are neurological conditions such as stroke and chronic conditions such as arthritis. Supervision of the OTA at home healthcare. The OT must provide initial consultation, evaluation, treatment plan, and periodic reevaluation of the client's progress. The OT must ensure that the OTA implements the plan appropriately. In California, OTAs at home healthcare settings usually operate under general supervision, meaning that the OT is not required to be physically present during services. In home health, the OT must have direct contact with the clients at least once every 30 days to reassess the client's progress and modify the plan of care as needed. In California, OTAs must be supervised at least once every 30 days, and the supervising OT must be reviewed and co-sign all notes written by the OTA. The OT must document all supervisory activities, including the frequency, methods, and contents of supervision. The OTA must also document their interventions and communicate any changes in the client's condition to the supervising OT. For experienced OTAs, routine supervision may include and involve periodic check-ins, case reviews, in contrast to newer OTAs or complex cases. Closer supervision may be required, including more frequent communication and direct observation of the OTA's performance. Now, how would I advocate for home health care? Well, I will use these three main points. It promotes independence. Occupational therapy helps patients regain or maintain independence in their daily activities. Home healthcare occupational therapy focuses on modifying the home environment and teaching adaptive strategies to ensure safety and functionality, which is really important because it prevents hospital readmissions. Occupational therapy interventions minimize the risk of falls, injuries, and complications by addressing barriers to recovery in the home. Occupational therapy facilitates a successful transition from patients moving from hospital to their home. It is cost effective. Occupational therapy services in home health care are cost effective as they reduce the needs for institutional care and support individuals aging in place. Who would I advocate to? I would advocate this to state occupational therapy associations. These organizations usually work to influence policies and regulations at the state level. For example, in California, it would be the California Board of Occupational Therapy. Federal agencies, organizations such as Centers for Medicare and Medicaid Services advocate for adequate reimbursement and coverage of occupational therapist services under Medicare and Medicaid. Now, how would I justify the importance of an occupational therapist assistant? With three main points. Occupational therapy assistant extends the reach of an occupational therapist. An OTR can supervise several OTAs to serve more patients, in contrast of the OTR serving only one patient at a time. In California, they're allowed to have 3 OTAs under one therapist. That expands their reach 3 times bigger. And if they're having a caseload, that means that they're expanding their reach by 4 times. Something to consider. OTAs can provide continuity of care. Continuity of care is critical for patients' adherence and long-term success. As like we said, transitioning from hospital to the house and continuing their care improves their general quality of life, enable them for success for their treatment, reducing the risk of falls and re-injuring themselves. The last important one that I would have to point out is that OTAs are cost effective. OTAs provide high quality care at lower cost, making OT services more accessible and sustainable. That is it. This is my presentation. I hope you enjoy it. And next is my references where I got all the information that I spoke of. Thank you so much for your attention. You have a great day.